President.
Senator from Georgia.
Mr. President, September is National Suicide Prevention Month. And I think as a member of the Veterans Committee, as an American, as a member of the United States Senate, it's important for us to pause for a minute and recognize some alarming facts about suicide in America among our veterans. On average, every day, 365 days a year, 22 veterans that have served America take their own life in suicide. That's 8,000 veterans a year, an alarming number that is growing. It is important for us to recognize the need to see to it our veterans have access to those things that can help to prevent suicide and make sure that it's minimized and happens as little as possible. Recent surveys by VSOs, the Veteran Service Organizations, have demonstrated that an alarming number of veterans in America, out of our 22 million, have actually considered suicide. And an even further alarming number actually know someone who attempted to take their life or in fact was successful. Now we know there are reasons that can reach out and help us, and we know there are reasons that are hurting us. Some of the things that are hurting us right now are long lines for veterans in needs of mental health. Mental health needs are an emergency. They are not something that is not time sensitive, and we've got to improve our wait times so they're not as long at our VA hospitals. There is a nationwide shortage, both public and private, of mental health providers. We've got to work on seeing to it that we improve the number of providers for our entire country. Scarce appointment times for veterans because of their work or family opportunities, and scarce appointment times because of overworked VA hospitals make it sometimes difficult and protracted for a veteran to receive services. Biggest of all to me is the gaps in the continuum of service and treatment to a veteran under mental stress and depression. And I want to focus on that for just a second. Recently, I held a VA field hearing in Atlanta, Georgia, because of the tragedy that took place at the Atlanta VA. We had 2 suicides of veterans under the care of the hospital and 1 overdose of drugs while someone was in the hospital and under the care of the hospital. Those brought about an Inspector General's report that made a plethora of recommendations to the Veterans Administration in Atlanta, but also nationwide, on things the VA needed to do to address those problems. To the credit of Director Petzel, who's head of all VA medical care, and Eric Shinseki, the Secretary of the Veterans Administration, the VA has begun taking initiatives to do so. But we've got to make sure they accelerate those initiatives and provide the care that is necessary so that wherever possible, we eliminate the wait times and the lack of continuum of care. In a recent survey by the Inspector General, they found that 20% of veterans, 1 in 5, who were referred to a private mental health provider, never got an appointment. Mr. President, that's 1 in every 5 veterans who have come in and admitted they have a problem. They may be at risk for taking their own life. They may be in depression. That is unsatisfactory. One of the focuses we made in our hearing was bringing about better coordination by the VA in terms of accessing community resources in mental health to see to it we raise the number of providers offering mental health services to our veterans. As I've said earlier in my remarks, suicide is preventable. It is not, however, preventable if there is no access to therapy, no access to consultation, and no access for our veterans when they need it the most. Now let me brag a little bit about the VA and some of the things they've done in recent years that have helped, and give you some amazing statistics. In 2007, the Veterans Crisis Line was conceived, where veterans in trouble for themselves can call in and receive counseling. More than 814,000 calls have been received by the Veterans Crisis Line since it opened, and 28,000 interventions have saved the lives of veterans. That's 28,000 veterans who are alive today because of the Crisis Line. In 2009, the VA added an anonymous online chat service where a veteran could have a non-threatening way of communicating and seeking therapy anonymously. And that has numbered 94,000 calls since its inception. And most impressive to me, in 2011, the Veterans Crisis Line added texting as a way to expand its accessibility to veterans. If you're a veteran in crisis, we need to make sure as American United States Senators and as members of the Veterans Committee that you have the access you need to the therapy and the counseling when you need it. We all know the tragedy of suicide is terrible on a family and a horrible loss of a life that was sacrificed on behalf of the United States of America. And we owe it to ourselves to see to it that the Veterans Administration continues to improve access to mental health services, continues to reduce the wait times and long lines, and continues to cooperate and reach out to the community to bring in private providers on a referral basis so that veterans in need of care get a referral and get an appointment quickly. My last point on that too, Mr. President, it's important that the VA be sure they follow that veteran to see to it they keep that appointment. In the cases of suicides in the Atlanta VA, the failure to keep an appointment or the failure to have a continuum of care and following of that veteran substantially created and contributed to the loss of that life. So while we've had tragedies at the Atlanta VA, things are improving. While we've had tragedies in suicide across the country, we're finally focusing on veteran suicide. Lastly, we need to focus on the fact that there are many contributing factors to suicide. Many people will think it's someone returning from Iraqi freedom or enduring freedom. In some cases, that is true. But more often than not, veterans over 50 are the victims of suicide. In fact, of the ones in Atlanta, they were Vietnam-era veterans at the time. It's important we understand it's every veteran that's at risk. It's every veteran that needs access to treatment. We need to understand our veterans, we owe our veterans a big debt. Most importantly, a way to see to it they don't lose their life out of despair and depression, but their life is saved because our VA cares enough to see to it they have the continuum of care and the access to help that they so virtually need. So to the VA administration, thanks for the improvements they are making. To every member of the Senate, let's continue to support the Veterans Administration and the funding necessary to deal with the more than 1 million new veterans returning home because of the wars in the Middle East over the last decade. And I yield back the balance of my time.